So this, just a bit of context on this project. This project is been funded by the CRCSI, and it's just a PhD scholarship, so I guess it's relatively small compared to some other ones, but it's my first go in the CRCSI, so I'm pretty excited by it. It fits in the health program. Just to give you a bit of context, that's the health program. You've got various projects, and then we fit in the middle there, so we fit clearly in that area. Just a bit of background, but I think most of you will have got some of this by people who are far more qualified than I, but we've had a number of earthquakes in Christchurch starting in September 2010. The main one is on the left, the big green star, and then the red star on the right is the one that happened in February, which was the most destructive one. And there you've got an idea of the aftershocks we've had since then, and the size of the circle indicates the size of the aftershock. What this map shows is the swarms of quakes 24 hours after each of the four major events, and as you can see there's a distinct geography to it. So it's, and generally the closer you are to the centre, then the more you feel it, although there are a number of other variables that come into play there. The other thing about it that I think is interesting from a health perspective is that it is actually unlike many other earthquakes in the world in that it's actually far more ongoing than most earthquakes. People have made the comparison to the Haiti earthquake, which is a very similar size, similar depth, and similar proximity to the central city. And I think they had about 1,000 aftershocks. We've now had over 10,000 aftershocks, so it's actually quite different to many earthquakes. I got it last week. This shows the aftershocks. So as of last week, we had over 10,000. Pretty much, you definitely feel anything above a 4, and depending on what you're doing, you feel anything above a 3. Below a 3, you don't generally feel. So what you can see there is there's a lot of aftershocks you feel. And this is important in the context of what I'm going to talk about this study in a minute. This shows the maximum magnitude of the aftershock, and then the quakes per week following it. So what you can see is that when we have a large aftershock, we have more shakes in that same week. I'm not sure about everyone else, but I live in Christchurch, and I'm getting slightly worried about the pattern here because we're now over here and we haven't had a big aftershock since over here, but I'm sure it's nothing to be too concerned about. But the main message of that is that there's ongoing large numbers of aftershocks, and as I say, it is important. So we know that about 70% of the central city is being demolished and will have to be rebuilt. Somewhere, and there seems to be some slight uncertainty, but roughly sort of 15,000 to 20,000 residential properties will have to be rebuilt, and there's over 100,000 properties have to be repaired. And so it is having significant impact on the population of Christchurch and the greater Christchurch region. And what it means is that there's going to be ongoing community impact, and the ongoing community impact is going to last for a long time. So there are a number of facilities either permanently or temporarily closed. And the reason I'm telling you about these is because potentially these are things that will affect people's health in the context of kind of anxiety and stress. So schools and shops and GPs, some have closed permanently and some were temporarily closed for a number of months. There's a lot of people in temporary housing arrangements, so there's people moved into smaller housing. We've heard about, in the media, we read about people living in garages and even people living in cars. I don't think there's many people, but it's certainly a thing that gets in the media quite often. There's also a lot of community breakup, so a lot of people have moved out of their natural communities, and what we want to see is the stress involved in you moving out of your communities affecting your health. We know that people are now making unusual journeys, so people are now perhaps living further from work, or they're taking their kids long distances to school, or they're taking their kids long distances to meet their friends. So there's a number of other factors that can be causing stress to people. Richard McGeorge mentioned the other day about the red zone and how there are whole communities who have been moved. So the red zone is areas where it is deemed unviable to rebuild properties because the land is so unstable. So there are whole communities where people have been moved out. And that means that those people who are in those communities, they're disrupted, and it might be argued that this is stressful to them. And finally, there's also some uncertainty over the state of land and the rebuild. So the colour of the land changes. So you might be one day, it will be said that your land, we're not sure what you're doing with your land, and then you might suddenly become red zoned, or you might become one of the categories of green land, which Richard talked about. And we can look at whether the uncertainty and the changing uncertainty is actually affecting people's health in the context of stress and anxiety as well. So there's a number of different health effects. there was obviously some immediate health effects in terms of injuries and fatalities, and there's some, the District Health Board is coordinating some research looking at that. One of the things that was interesting about that is that most people were actually not treated in hospital. They were treated in all sorts of places, and in some cases then sent home. So actually this thing should be straightforward, but isn't, because to some extent many people went home treated, but no record was made of that. And that was because people just treated them where they were. There was actually a conference of health professionals in the city centre, and those health professionals just went and treated people in the street. So that's actually a bigger job than you'd think. There's potential medium-term impacts, some related to sanitation. So a lot of people were without water and sewage. The water was, you had to treat your water for a number of months because we weren't sure about how safe it was to drink. And then there's issues about liquefaction dust. So we measure particulate matter in Christchurch, and liquefaction dust falls into that, but chemically it's different, and we're not sure the health effects of that. So there's kind of some medium-term impacts. This project is mainly concerned with the ongoing health impacts, so the stress-related health impacts. So what are the stresses on people's lives, as some of the things I mentioned in the previous slide, and how are those stresses affecting health? And that's going to be ongoing, and it's going to last a long time because there's a lot of uncertainty about some of these things. What we know is that in the months afterwards, there's the newspaper reports about stress or anxiety-related ill health. So, for instance, it was actually shown that suicide numbers dropped after the earthquake. And the thinking behind that is that community was really strong. So communities really got together, and people actually kind of felt they had someone to talk to. And so that's an interesting, I guess, an outcome of an earthquake. And then it carried on. I don't know who put that in. Oh, well. Sorry about that. Notice the little circle around it's the wrong colour, of course. It shouldn't be a sort of golden colour. Anyway, I'm English, so I've got nothing to shout about. There's also research more recently, so this is stuff from last month in the media, where it talks about stress is still elevated in the quake aftermath, and I think there's no reason to think that that's going to change in the near future. A newspaper again reporting about people battling depression, and it's linking it to the aftermath of the earthquakes, and how school children are finding it tough as well. So this stuff is in the media regularly, but to some extent it's being attributed to the earthquake, but we're not sure if there's a geography to it. And so I guess there's two main research questions. Is there a spatial relationship between the extent of physical damage and non-injury psychosocial stress-related health outcomes? So in other words, if people who live in areas that are more damaged and more affected, are they displaying more stress-related health outcomes? And secondly, are they greater amongst those people, or is it just that everyone who lives in the city is stressed when the ground shakes? And I think this is the important question. So is it everyone's stressed, the ground shakes, everyone's stressed, and people's nerves are on edge? Or are people who are most affected those people who are most physically affected? And so in other words, if your house is damaged and you're in a community that's disrupted, you're moving house regularly, you're in an unsatisfactory housing situation, are you more affected? And this is what we don't know. And of course, those two questions have important health policy responses, because if we can predict after major natural disasters like this who is most likely to be affected by health, then we can target health service provision better. At the moment, we don't know the answer to those two questions, and therefore we don't know how to target health services. So how are we doing it? George very kindly mentioned I've done some work on pollution exposure, and in a way what we're doing is we are taking that sort of approach to developing indicators of earthquake exposure. So the sort of things we're going to include are the extent of home damage. So how exposed are you to home damage? How exposed are you to infrastructure service closures and restriction? What about community disruption? Amount and extent of liquefaction? Because liquefaction, yes, there's the effects of potentially breathing it in, but also just having it around is not a particularly pleasant thing. It's not attractive. I think Wendy showed a good image of people clearing up liquefaction. And liquefaction's still out there. There's still parts of the city where there's still quite a lot of liquefaction. Liquefaction dust, as Wendy said, it's an adjective and a noun there, but there's liquefaction dust still present. The magnitude of shaking, so we have some indicators of shaking. So is the amount of shaking the land you feel where you are, does that affect you more if you are exposed to more shaking? And what about changing of land colour? So if you're in the orange zone, which is where you're not sure if you can rebuild again or not, do people in that area, are they more stressed about the fact that they don't know what's happening? So what we're in essence going to do is develop estimates of exposure to these sorts of things. Now the reality is we don't know which ones affect health, and that's, I guess, what makes the research exciting, I think. In terms of health data, we've got a number of sets of data. We can get information about people attending the emergency department and then separately those admitted. And the evidence at the moment is that the number of people turning up to hospital emergency departments is lower than it was, but the number of people actually being admitted to hospital is exactly the same. So the suggestion might be that people are only turning up to hospital when they feel like they're more likely to be admitted and there's something happening. But again, we don't know if there's a geography to it. We have a service called Healthline, which is a free phone number you can phone up and get health advice, and we will be able to get access to point data for that. Getting access to point data is really unusual in New Zealand, and we're getting this through this collaboration with this grouping called RISE, which is research into the health impacts of seismic events. Plus, we've found out we've got some other data, which this is since we put the application into the CRCSI. We have a thing called ACC, which is a government insurance scheme for accidents or injuries. So if you have an accident or an injury, then you get health care free. And there is a number of claims where people have attributed their claim to the earthquake. So for instance, we've just got a data set this week, last week rather, looking at people who are going for counselling, and the counselling is attributed to the earthquake. And we're going to be able to get that for point data as well. And finally, the Ministry of Health does a health survey every 4 years, and it just happens or every 6 years, and it just happens they're doing it in 2012. And they've added some extra questions about the earthquake and added some extra people in for Christchurch, and they've said we can have that data. We're not quite sure yet if we'll get that at point data, which we really do need, because we want to be able to, I'll explain what we're going to do and how it's important to have point data. It's important to get point data because we need to track individuals back through time, back to September 2010. Because what we do know is that many of the most affected people have moved house because their house has been destroyed or it's unsafe to live in. And we need to know where people were living at the time. We need to know where people have lived since. Have they moved into areas equally disrupted? Are they constantly living with the uncertainty of not knowing where they're going to be living in the future? We can get that information from postal redirection information, and I think Richard mentioned that. There are some concerns about how accurate it is in terms of the overall coverage, and so the other data set we are investigating is data from insurance companies, because particularly if your home has been destroyed, you have to let your insurance company know because they then pay for your rent. So insurance companies probably have the most complete data on this. So the geospatial challenges, the first one is to determine exposure to earthquake-related anxiety and stress, and I don't think anyone's done that, and that makes that really interesting. The second bit is to track mobile populations through the environment, so we need to know where people have lived from the point of diagnosis back through the earthquakes, and then we need to relate the two to each other. Finally, just the research team, there's me at the top in a tie, which I don't wear very often, but I've got found a photo of me in a tie. We need a PhD student, so we're going to be advertising for PhD students. We have Professor Mike Arder, who is the Professor of Emergency Medicine, who's helping us with data. Tom Wilson is a lecturer in Hazards and Disaster Management, so I guess they're the key people who will be supervising the students. We've also got other people who will help us when and if we need them. So we have Amber Pearson, who's a postdoc in GeoHealth, Greg Breitsker, who's an applied GIS user in crime mainly, but social applications. Elena Molchanova is a lecturer in spatio-temporal statistics, and Sonia Giovinazzi, who's a research fellow in GIS and hazards. And then Narelle Mullen from CRCSI in Curtin, James Semmons, Curtin CRCSI, and Taryn Weeramanthri from the Western Australia Department of Health. So those other people are all involved in different ways, making sure we get a really good project, which I'm really excited about. Thank you very much.